Today we're going to be talking about some key points to check for good wheelchair positioning. First of all, does the resident look comfortable or uncomfortable? Are the wheelchair and its parts in good working order? Is the resident sitting upright and near midline, or are they leaning to one side, slumping down, or sitting heavy on one side? Are the feet and legs comfortably supported, or do the feet sit flat on the floor if the patient uses their feet to propel their wheelchair? Are the armrests within 2 to 3 inches of where the elbow naturally hangs? The distance from the front end of the seat upholstery to the back of the knees should be no more than 2 to 3 inches. Can the patient reach the wheels and the brakes? And finally, looking at it, does it look too big or too small for the patient? I've developed a rule for looking at patients and deciding whether or not they're sitting in a correct size chair. I call it George's rule of thigh. We determine the correct wheelchair height as it's critically important to achieving good wheelchair fit and assuring both functional outcomes and patient comfort and safety. When looking at the tops of the thighs in profile, do they slope downward from the hips to the knees? Are they fairly level, or do they slope upwards from the hips to the knees? If the thighs are running uphill, which means the knees are higher than the hips, this can be okay, unless the chair is too small for the individual, or if they've had a hip replacement with precautions to avoid greater than 90-degree angles at the hips. For individuals using leg rest or foot rest to support their feet, this indicates that the leg rests need to be lengthened or shortened to achieve a more level thigh, thus achieving better body alignment and better pressure relief. Running downhill, the knees lower than the hips is not good. Usually indicates that the chair is too tall or that the setup or the cushion is not supporting the patient as they attempt to propel with their feet, thus pulling them down and out of the chair. Often the patient will feel as if they're sliding out, and in some cases, they'll actually do just that. Let's talk about some special considerations to the rule of thigh. Patients in wheelchairs that are too high are often at much greater risk of pressure ulcers and excessive pressure at the back of the thigh, the sacrum, and the scapulas as they lean down. Weaker patients often can slide down for a little pressure relief, but often can't slide back upwards again to regain a safe sitting position. Frequently, these patients are seen as a fall hazard and are given a lap buddy to help keep them from sliding, which further limits their options for pressure relief and often leaves them in a painful condition. Adjusting the wheelchair height in multiple axle wheelchairs. With today's wheelchairs, we can easily adjust the height of the wheelchair and the angle of the wheelchair. The first thing we want to do is locate the moving rear wheels, and we want to adjust the bolts so that we can adjust them either higher or lower. Locating and moving the front wheels, which we also call the casters, can give us a tilt to the chair or again allow us to lower the complete seating surface. When adjusting the front casters, first of all, you want to make sure that you have one that's multiple. So you want to take a look and see if there's more than one hole. Once you've determined that you have multiple front casters, what you want to do is unbolt a bolt, pull it out, and then you can adjust the caster or the front wheel up closer or higher, which allows the front end of the chair to come down, or reverse that and bring the wheel farther down if you want the front end of the chair higher. And you want to make sure that you redo the bolt, make sure the nut is just tight enough. This chair is set up in a reverse tilt, which means that the larger wheels are set up so that they're in the lowest position. The front wheels or casters are set up in the highest position. And you'll notice the seat base then kind of leans backward. This is the best position for patients who are trying to propel with their feet, and generally helps provide a more anterior pelvic tilt and decrease a posterior pelvic tilt, or that slumping that you see in some residents as they try and pull themselves along with their feet. A word about using adjustable leg rest. The first word is, are they needed? Oftentimes we want to make sure that a patient who can propel with their feet can do so. But if a patient cannot, we want to make sure that we follow the rule of thigh and making sure that we adjust the length of the leg rest so that the thighs are pretty much level. This assures that they don't have undue pressure and that they're in a functional position. Let's talk a second about cushion basics. First of all, we want to make sure that the cushion is not damaged or it hasn't lost its cush. Cushions have a lifespan. No matter how good they are, or no matter how much they cost, they don't last forever. I also like to make sure that the cushion is tied to the wheelchair frame. This reduces sliding effect. If you don't have ties on the cushion, then you can also use Dyson or shelf liner to make sure that it's not sliding. Let's talk for a second about cushion types and effects. To check the fit of an adjustable cushion, such as a Rojo Mosaic, where you can add air or release air, you want to make sure that the cushion doesn't bottom out. If it's bottoming out, the patient isn't getting the benefit of the pressure relief. So you want to make sure that you take the cushion and make sure you find your inflation device, and you should inflate it to a point where you can push your fist into the cushion and you shouldn't feel the wheelchair or the wheelchair frame beneath your hand. Finally, a word about repositioning. Residents in a wheelchair who cannot reposition themselves often need our help. We have to make sure that the hips are all the way back, that they're in midline, not sitting off to one side or not slumping. And we should do this as frequently as possible. And finally, we want to make sure that we teach everyone. Teaching is important. We need to make sure that we're teaching the aides, teaching the family, anybody who comes into contact, because the resident really needs to be adjusted at least every hour to 90 minutes. I hope you find this video helpful. Visit rehabsynergies.com for more information. Thanks for watching.